Well, hello. Welcome to another lecture in Counseling 5480 class, Diagnosis and Treatment Planning. Today, let's talk about assessments that are commonly used in counseling. When I was a little child, I used to really want to become a detective because I thought I was super smart and I thought I was, observant and it must be super cool if I can just piece together a fragmented story and reveal the truth and tell everyone. After many, many years, apparently I failed to become a detective. Instead, I am a counselor, which is just as cool as a detective. And sometimes, I still feel like as if still a detective. I'm still doing some detective work because, I'm still trying to use the information I collected from the client to come up with the story of this person. However, instead of relying on my own observation, my intelligence, I rely on some really valid and reliable assessment tools in counseling. Let's look at them today. Do you recognize what this is? Does it look familiar to you? Yes, this is the famous Rorschach blot test. This test shows different pictures of ink blots. It doesn't mean anything, but they ask people what they see from the pictures. People's perceptions of these ink blots are recorded and then analyzed using different kinds of psychological interpretation. By doing so, the practitioner can come up with person's personality characteristics and emotional functioning level. What do you think about this? Do you believe it is valid? Do you see it's helpful in any way? Do you see it's not valid or reliable or it's not helpful in any way? As you can imagine, assessments like Rorschach test can be very subjective because the interpretation are highly based on the therapist's training background, their theoretical orientation, or maybe their own personal experiences. Therefore, it's really hard to say if the test is that valid and reliable. Nowadays, we use assessments that are making more sense and can really promote effective treatments. There are different ways to categorize assessments, and today I just put them into two groups. Um, Qualitative assessments are those that can be blended into treatment strategies to guide self-discovery and to inform clients. It usually takes in the format of interview. They are flexible, they are open-ended, they are holistic, and since there are not many numbers involved, they're also not very statistical in nature. On the other hand, quantitative assessments are those that involve numbers like most surveys and questionnaires, and they are structured because there are always certain number of questions. They're close-ended. They're focused on a specific topic area, and because there are numbers involved, therefore statistical analysis are usually needed to come up with the result. Other features of qualitative assessments include that it can be easily incorporated into session, right? You can just, ask them questions. There's usually a debriefing process afterwards. So like after an intensive interview, a debriefing process will look like something like you explore clients' feelings and thoughts about that assessment and kind of process those feelings with them together. The interpretation of the results are comparatively subjective to quantitative assessments. And other features of quantitative assessments including usually they are not a part of a counseling session. Usually you have to schedule the assessment on a different date and time. So they're not in flow of a counseling session. But then, so you administer the test, and then afterwards you will do some calculations, and then you will maybe schedule another time to provide the feedback to your client. They are kind of objective because the results are relied on statistical measures. Now let's check out some popular assessments. Qualitative assessments that are commonly used in counseling include role plays, games, especially if we are working with younger children, genogram, which will come up later in this lecture, scaling questions. Scaling comes from solution-focused theory. So basically, you are asking people to evaluate one of their issue, maybe like anxiety, on a scale of 1 to 10, with 1 being not anxious at all, with 10 being extremely anxious, and ask them where they are on that scale. Adler's fantasy questions, which are similar to miracle question, which is also from solution focus theory. And then there's also drawing assessment. I think that one is actually pretty fun. So there's either house tree person and or draw a person. And then on the right columns are some popular quantitative assessments that are used in counseling. BDI is a really common one for depression, and then they also have like anxiety inventory. PSS is an assessment for PTSD or trauma symptoms. There's also comprehensive OQ 45.2, and then Michigan alcoholism screening test. Apparently, that's for to assess the level of alcoholism, the alcohol usage. And there's also another anxiety inventory here, state trait anxiety inventory, another depression test called Hamilton Rating Scales for depression, and then there's also that famous MMPI. Genograms is a helpful tool for clinicians and the clients to see the intergeneration patterns. The concept is very similar to something like a family tree, where every single person, every family member is represented by a specific symbol. Usually we use circle for females and we use squares for males. And we use straight lines to show straight horizontal lines to show that these two people are married or maybe they're in a relationship. Across usually represent the cutoff of that relationship, or maybe they're separated. For each family member, you can write their name, you can put their age and their birth year in there. You can do all kinds of stuff. Like if you want to explore the patterns between career choices between family members, you can just write down everyone's job. I personally really like to use this, especially when I see client who carries lots of family trauma, or younger people who are struggling with separating from their families. So starting COVID pandemic, I started doing online counseling, right? So I also explored a website that provides a really good tool. It's called GenoPro. So download that software, you can create genograms electronically. I believe there's like 30-day trial, so I included the link down below. If you're interested in it, you can just download one and create a genogram for yourself. I personally really like using scaling questions because it helps both parties to be on the same track. Like, for example, my client may tell me, I feel a little bit fearful. And then I don't quite know what does she mean when she said a little bit. So I asked her to give me a score, then she gave me a score of a 6 on a scale of 1 to 10. Then I realized, oh, a little bit actually means more than 5. I always use my scaling questions during the treatment planning stage. I also use it whenever I need to review certain treatment goals with my clients. I find it really helpful to use the scaling question with those who may have trouble expressing themselves or describing their symptoms. Again, this is the website where all the DSM assessments are included. I highly recommended you to bookmark this website because you may really want to use some electronic DSM-5 assessments, and it becomes handy. Among those assessments, one of them is called Cross-Cutting Symptoms Measure, or simply CCSM. There are 2 levels. Level 1 CCSM evaluates symptoms areas, evaluates 13 symptoms areas for adults and 12 symptoms areas for children in a 14-day time frame. Level 2 CCSM evaluates individual symptom area in a 7-day time frame. The highest score in each symptom area of level 1 determines whether a level 2 measure is needed. DSM created CCSM to capture who might need further assessment for all clients. There are also a group of measures that are measuring each individual disorders, and you can also find those measures online. Let's look at an example to see how this works. This is a level 1 cross-cutting symptom measure. Let's assume someone scored 2 for all the 3 items in the domain number 4. So the highest score of this domain is 2. Now let's check out the threshold for further inquiry in this domain, which is domain number 4, anxiety. It should be mild or greater. So number 2 equals to mild. Therefore, according to this chart, this person does need to be assessed using a level 2 measure, which is anxiety adult promise emotional distress anxiety short form. You may want to ask, oh, I don't know what this short form is. No worries. Just go to that website and you should be able to see this. So this is that anxiety form that I just downloaded from the website. And then you do another interview, or maybe you do a self-report. In this example, you can see the total raw score is 26. Based on this instrument manual, the T-score for this person is 67.7. So as I mentioned before, DSM also provided some disorder-specific severity measures. They are the instruments for diagnosable mental disorders. This is an example of a measure for anxiety. I want to take some time to look at each individual items to see what do you think about these. And then this is another measure for depression. Again, I want you to try to take some time and look at these items and see what you think about these. While you are evaluating these items, you may also want to open the DSM book to compare the criteria, the diagnostic criteria of depression and anxiety to these 2 measures. Do you think they're valid? Do you think they're reliable? The third measure or example measure I want you to see is this measure for oppositional defiant disorder. And I did not cut off anything because there's only one item for the clinician to evaluate the severity of someone who has ODD. What do you think about this? So, what do you think? Do you like DSM assessments? Should we trust the results or should we take the information as a grain of salt? In their 2014 article, Schmidt and Balking have reviewed a variety of DSM assessments and concluded that, for some of those assessments, the reliability data is missing. In other words, we still don't really know how reliable those assessments would be. In addition, Level 1 and Level 2 CCSM assessment may not align with criteria of all the disorders. So, what's your takeaway of this? Well, we should be cautious with the interpretation of the results because the assessments may indicate the probability of certain disorder, but it may not be necessary, especially because we don't know if the assessment is reliable. On the other hand, the results can come out fine, but the individual is likely to still struggle. So if that's the case, how do we choose a valid and reliable assessment for counseling? My suggestion is that you probably want to do a little bit more work by looking up online to find some articles about that assessment that you want to use. Especially look for any reliability evidence and validity evidence. Also, just always keep learning about new assessments. Um, receive proper training for certain assessments. You do never administer any assessment that you're not properly trained. In the following slides, I have included some reliable and valid assessments that are commonly used in mental health field for different disorders. You may want to take a look at some of these assessments, and maybe you just want to take notes of these assessments so that you can know which one to use when you need to. When you're doing your homework and you don't really know which scale to choose, feel free to email me and we can have a discussion on which scale would be a better scale. Alrighty, this is the end of the lecture. I hope you enjoyed this video and find this to be helpful. Remember to email me with any questions that you might have, or simply come to my office hours so that we can have a meaningful conversation.